Ladies and gentlemen, good morning. Today is the 25th of October, and this is our 11th webinar. This is the DiaBeat webinar in the RAK Diabetes Challenge. And our topic is heart health. Now, friends, when I read up last evening about the relationship between diabetes and heart health, I seemed to find nothing that was anything except problematic. It says that diabetes doubles the risk of coronary artery disease and cardiac ailments, doubles the risk. Now, if you were to read standard literature, you would find about 50 to 60% of the global population will suffer from coronary artery disease. And it would seem that diabetics are more prone to this cardiac ailment. And there's further bad news. Diabetics have more complications with heart attacks and strokes. Diabetics have a higher risk of fatality, not only for coronary artery disease, but also for heart failure. Now, diabetes causes the hardening of the arteries, a term referred to as atherosclerosis. And this inhibits the circulation of blood to the heart. But there's more. It also causes the hardening of heart valves. Now, ladies and gentlemen, it serves no purpose me presenting problems. We must find solutions. And the first step we took in that direction is to find a highly skilled cardiologist to present on this topic. We have with us today Dr. Tarek Jarkas. Now, Dr. Tarek is a cardiologist with over 18 years of experience, both in interventional and in non-interventional cardiology. He completed his fellowship in cardiovascular medicine at the Heart Center in Saar, Germany, and received the Board of Internal Medicine and Cardiology certification from Germany in 2015. He has performed more than 5,000 coronary angiograms and over 2,000 angioplasties. I told you we would find the right speaker. And furthermore, he has built the program of minimum invasive interventional therapy for heart valves, the aortic heart valve replacement, the mitral valve, the tricuspid valve. He deals with the entire heart. Well, I would imagine in a lighter sense, it would be appropriate for all of us to go to Dr. Tarek when we have a heartache. Okay, and as they say, friends, I fly almost every week with Emirates, and as they say at the start of every program, every flight, they say, our hostesses can speak several languages. And therefore, I say the same with Dr. Tarek. Dr. Tarek speaks English, with which I hope he will talk to us in this program. He speaks Arabic and he speaks German. Ladies and gentlemen, forgive me my little light-hearted comments, but may I introduce you to Dr. Tarek Jarkas.
Thank you very much, Professor Adrian, for that introduction. I'm very happy to be here today for Dr. Wilco for all the organization efforts. I want to thank you, all of you, to joining us to that webinar. I hope I will give you, I will deserve that introduction, that excellent introduction. Thank you very much, Professor Adrian. Good. I will try now to share my slides. Should be, yes.
Yes, doctor, we can see it.
Can you see my?
Yes, sir, we can see.
Very good. Very good. Again, good morning. Good morning, ladies and gentlemen. Thank you for joining us. We will speak today about a very important and interesting issue. It's about the relation between the diabetes mellitus and heart disease. At the beginning, I wanted to...
Doctor, sorry.
Yeah.
Oh, now it's okay. Perfect.
Can I continue?
Yeah, sure, please.
Good. Okay. At the beginning, I would like to share with you some information about the diabetes. The diabetes mellitus is one of the general health general world problem. It's all around the world. In year 2021, it's about 337 million adults have living with diabetes mellitus. That number is about 1/10 of all of the adults all around the world. The problem is it is predicted that will be getting more. It will increase the number of diabetes, the people with diabetes, to 643. And in year 2045, it will be about 783 million adult with diabetes. That's a very big problem. It's about 1/8 of all the adults all around the world will have diabetes. At the beginning, I want to try to review the mechanism of diabetes mellitus to understand a little bit about what I wanted to tell you. The metabolism, the normal metabolism of diabetes, usually when we take a food, when we swallow the food, the glucose, the sugar will go to the blood. The pancreas, it's responsible for secretes insulin. The insulin is the main hormone that regulates the blood sugar. It helps the sugar to go to the inside the cells. The sugar is very important for the cell function. Without sugar, the cells couldn't be functioned well. And that's why in normal, healthy people, we have no problem. The insulin will be secreted from pancreas. The glucose will go through the receptors with help an insulin receptor to go to the inside the cell. Now, in diabetes, what happened? In type 1 diabetes, the pancreas couldn't secrete enough insulin to let the sugar come inside the cells, and the sugar stay outside the cells, in the vessel, in blood, and it cause high blood sugar. Here's the problem in pancreas, with a gland as a gland, its problem, and that's its very different from the type 2 diabetes mellitus, which the problem not in pancreas. The pancreas could secrete insulin, but we have the problem in insulin receptor in the cell. That means in the type 2 diabetes mellitus, as the problem is a metabolic problem, not in the pancreas. It's all the cells in the body are involved. Good. Now about to understand how is the prevalence of the diabetes mellitus. The type 1 diabetes mellitus is usually about 5 to 10% of the cases. And the vast majority of the cases are type 2 diabetes mellitus, about 90%. And the problem here, as you can see, the problem here in the both in the pancreas and the type 1, and the type 2, the problem in all the body. As you see, it's metabolic syndrome. We will speak about it in the next slide. But I wanted to share that with you to understand what, how everything works. In this slide, I wanted to see all the complication of diabetes mellitus. You know, the most of them. Every organ could be involved, could be affected by diabetes complication. Today, we will concentrate on the heart, on the brain. Good. Why it's important to concern the heart and vascular health by individual with diabetes. I want to give you some information why it's important. The diabetes can harm the heart and blood vessels in different way. The type 2 diabetes mellitus are more likely to develop heart disease too. If you have diabetes mellitus type 2, it is the chance that someone die from heart attack or stroke, it will be 2 times more than the normal people. It's also contributing in many mechanisms to progress the heart failure. Similarly, also the diabetes can make the existing heart problem, it can make it worse. Very important to know that diabetes in women increase the risk 4 times more than the woman without diabetes. In the man, that risk will be double, also 2 times more. The good news is we can take measurement to lower the risk of heart disease, and we can improve the diabetes too. I wanted to go deeper and to understand the mechanism of in which the diabetes promotes the vascular atherosclerosis. The high blood pressure over the time can damage the blood vessel. The already damaged blood vessels are more likely to injured from high blood pressure, from cholesterol, from other damaged organs or factors. The buildup of plaque can clog the artery and causing to the heart attack or stroke or heart failure. Now I will take you in a journey to knowing more about the coronary artery. As you know, the coronary artery, as the heart is the pump which pump the blood to all organ in the body. It's very important to have continue his work to give us the oxygen and nutrition. The heart as a muscle, it need its supply. And here I want to show you the coronary artery. The heart take his own blood supply from the beginning of aorta, the main vessel. We will go a little bit deeper, a deeper look in the coronary artery. That's want to show you the coronary artery. That's a healthy coronary artery. It's you see the inner layer in the coronary artery seems to be thin and sees no problem. And it is 3 layer, the intima, the media, and adventitia. As a result of high blood sugar, the damage in the inner layer of coronary artery could be happened, and that will be easily to the LDL, the bad cholesterol, to go inside the artery wall. And with over the time that LDL cholesterol continue to immigrate between the layer, the high diabetes promote the inflammation that happens in here, and that cause the plaque. That thickness will getting more and more until it causing relevant occlusion or stenosis of the coronary artery. As you see here in that vessel, it's about more than 50-60% of the lumen. That's the normal lumen, and that should be here will be stenosed. And then we'll go to the next step. We have 2 scenarios. The slowly ongoing scenario, that will be the stenosis will reach the critical ratio. It's about 60-70%. Then you will begin to have chest pain. Also the heart here, in that case, the heart at rest, he will have no problem. He got enough supply. But on exertion, when the heart need more blood through that occluded artery, it couldn't enough supply come. Then the patient begin to feel the chest pain, the angina, discomfort, or the tightness, heaviness maybe, or shortness of breath. That symptoms will come at the beginning on exertion, and then with progress of disease, it will come at rest, and will be the exertion capability will be less. I wanted to share with you now the angina. It could be in the chest, it could be in the both arm, it could be in the neck, it could be in the stomach and the abdomen area. It's very important to know that, because the patient with diabetes, they will feel atypical angina. The angina will not what we know that. That's why very important to be aware of every symptoms between the abdomen, upper abdomen, and the neck. It could be kind of angina by individuals with diabetes. That's what we called as stable angina. It's stable, it took time to progress. The other bad scenarios, the surprising ongoing scenario. How is it happened? That happened when we have prompt occlusion of coronary artery through a blood clot. In that case, the blood will be stopped. As you see here, that's a cut in the small coronary artery, and a clot occluded the coronary artery. That means all that area after the occluded location, it will be not get enough blood or not supply and begin to die. And that's what called the heart attack or myocardial infarction. The pain come as crushing, substernal, it go to the neck, shortness of breath, cold sweating, nausea. It's very important. That's the typical, but many of heart attacks will go with minimal or without symptoms at all, especially by old individual and patient with diabetes, long-standing, especially long-standing diabetes mellitus. That's what called heart attack. Very important when you have such symptoms. Without delay, try to seek the medical help, medical care, and always important, the early medical care can save your life. In the same mechanism, when atherosclerosis involved or that begin in the artery of that supply the brain. It causes stenosis or prompt occlusion, and that cause the stroke here. Like I see here we take a small artery, it's occluded with clot, and you will hear that area of brain will be affected. It could be die. That's why any symptoms by patient with sugar, neurological symptoms, I mean now, it should be taken as a serious, and we should seeking the medical care to make further investigation. Now the next step, how to prevent heart disease. As I showed before, as a vast majority of the cases in the diabetes, they are people with type 2 diabetes mellitus. That's which is metabolic, not the problem in the pancreas, it's in the cell, in the all cells of the body. And here we have what we called a metabolic syndrome, which it's related to the overweight and especially abdominal obesity. And it is a kind of syndrome. Syndrome, it means more than one organ are involved, and it causes a hypertension, as a high lipid problem, polycystic ovarian syndrome, heart disease, of course, dementia, fatty liver, insulin resistance. The cancer risk will be high on diabetes mellitus. When you notice all the most of that organs or the most of that disease are affect the heart health, and that's why it's important to doing the prevention. We should consider all other problems that come together as a packet. And that's why it's very important to understand that diabetes alone is not the solution. You have a lot of other things you should be considered, and should be the measurement should took care to resolve it. I always like to present that the 8 Life's Essentials from the American Heart Association. It's very beautiful image. We will try to analyze it one to one. The first of all, the green one, it called Eat Better. The diet, the food is very important to take a healthy diet, especially fresh vegetables and fruits, nuts, whole grain products, and we should try to cut off or reduce the meats. We should try to avoid the trans fats, especially the fast food and all manufactured foods, or kind of foods or diet. Want here to talk about DASH eating plan. DASH is kind of diet. It is help to reduce the blood pressure easily, to take a low salt diet with a lot of potassium. I mean fresh vegetables and fruits, and try to reduce the meat and mere fruit. That kind of diet, it helped to reduce the blood pressure, about the systolic blood pressure, about 8 to 10 millimeter mercury. It's very good. It's like a blood pressure medication. It's very important to know that and to do that. Now we will specialize about the diabetes diet. It's from World Health Organization. It's recommended to eat a balanced meal. Like you see here, it's protein, fibers, and a lot of vitamins, nuts, milk. It's very good. Important to take reasonable amount, as not to take a very big amount of food in every meal. That now the regular eating, it's recommended 4 to 5 meal at the day around the time when you wake. It's a little bit, but I will let that for the diabetes specialist to speak about it. We need that to keep the blood sugar down and not have a very high blood sugar when you eat big amount of food. The second factor from the life essential life's essential, that's the workout, move more and work out regularly. Why exercise? The exercise, I think no one like to do exercise, but the exercise help to reduce the weight. That's very important. It is also decrease the risk factors. It decrease the blood pressure. It decrease the cholesterol level. It's enable to better blood sugar control. It's also prevent the complication, the atherosclerosis. It's help against the angina and myocardial infarction and stroke. It's also improve the quality of life and relieve stress. Very important to find the time to do it on the kind of sport. It's always, I've been asked, I make 8 to 10,000 step in my smartphone, show that. Is it not a sport? The sport, what we need to do it, it's two kinds of sport. The first kind is aerobic exercise mainly. It means some exercise which make your heart rate going higher. It's more than 100, 110 per minute should your heart rate goes. Should keep your heart rate high for 10 to 20 to 30 minutes. As according to your age, it will be recommended. The sport, what we need, walking, it means fast walking or swimming as very good sport. Swimming, it's very important to do that and not to sitting in the water, really to swim, to move all your muscle. Cycling is very good kind of sport. It's recommended 3 days a week, and we shouldn't stop or shouldn't take a rest more than 2 consecutive days. That's what recommended. Additionally, it's a muscle strengthening exercise. It's recommended too through building muscle mass. The needs of the body, the burning of fat and sugar will getting more on the insulin resistance will be improved. What's recommended as a lifting weight, yes, but not very heavy things as to working with weights, but light weights, it should be enough to making at least at time without having a muscle failure or muscle pain. It's too recommended as a 2 to 4 times a week. It's the combination of aerobic and muscle strengthening sport. It's recommended in the most guidelines and in the most recommendation. The third is going to control your blood pressure. The fasting glucose should go under 100 or 5.7. That's for the people without known diabetes mellitus to primary prevention. The individual with diabetes mellitus, it should be the hemoglobin A1C, it should be less than 7. That's the target. When we get it under 6.5, it will be perfect, but it's the target less than 7. Of course, keeping your weight, healthy weight, the BMI between 20 to 25, the cholesterol and lipids as with diet and with medication if needed. The blood pressure too is very important to have a healthy blood pressure. Should be the systolic should be less than 140 and diastolic less than 90. Stop smoking. Of course, the smoking is damaged the artery, especially the coronary artery. It should be stopped. All the product of nicotine and smoking, such vape and shisha, that's everything is very harmful. And last thing, it's very important to get enough sleep at night. That's a very important factor. All of us need the sleep, the quality of sleep. It should be at night. If you sleep not on day or around the day, that's not enough, or not. You feel it. You will not taking enough rest if you not sleep at night. Now, 2 minutes about the medication. We have around the years a very good medication that help us to control the blood sugar. But in the last 10 years, we have an excellent medication that help us to control the blood sugar. It's also have a very positive effect on all the organ of the body. It's called SGLT2 inhibitors. You know them. Maybe some of you know them. That's just Jardiance, Farxiga, and Invokana. These tablets try to secrete the sugar with the urine. That's the mechanism of effect, but it has a very good effect on the lowering the blood pressure, that reduce the risk of stroke, improve the renal outcome. It's protect the kidney from the diabetes. It reduce the cancer risk too, and improve the cardiovascular outcome. The other group I wanted to introduce, that the glucagon-like peptide receptors analog. It's a very good medication. In the last couple of years, it's widely used to reduce the weight reduction. It could help to reduce till 40% of body weight. But it's mainly a medication for the diabetes mainly, and they have a lot of good effect. They reduce the appetite, and they give you the feeling that you are you don't have to eat. They help the pancreas, the liver. It help to liver to reduce the fats and reduce the inflammation. A very good medication. If someone with diabetes with a high body weight and it can tolerate that medication, it's very recommended. And in the last year, it showed that it has a very important beneficial effect against the heart complication, cardiac complication by diabetes. At the end, always remember the question A and B and C and D and E and F and S. Why it's important to remember it? The A, like, is diabetes good controlled? That help you to prevent the diabetes, to control the diabetes and prevent the complication. The A for the hemoglobin A1C, it should be less than 7, and it's important to get it less than 7, and if we could get it lower, it will be better. The B, the blood pressure should be good controlled. The C for the cholesterol, is the cholesterol in healthy level? If not, please visit your doctor and let him help you to reduce your cholesterol level. The D, the drugs, the anti-diabetic drugs and all the medication, the drug adherence is very important. The people without who not taking their medication, they have a very big problem. That's why very important the diabetic and other blood pressure or cholesterol and all the medication are important. The EV, exercise, do enough exercise, try to find times to making the exercise regularly. It's very good for healthy life. And if the food and diet should watch your food, you should try to eat unhealthy food, try to reduce the manufactured food and try to going to the natural food, especially the vegetables and fruits. And as for smoke, stop smoking. All smoke, tobacco products and all smoke products should be stopped. A, B, C, D, E, and F, and S. Please remember that questions. At the end, I wanted to highlight the importance to knowledge on that such a webinar, on such talks to understand your enemy, your disease. I will quote from the Sun Tzu, a Chinese philosopher on strategica and war general. I would to change it. If you know your disease and yourself, you need not to fear the result of 100 battles. If you know yourself but not your disease, for every victory you gained, you will also suffer a defeat. If you know neither your disease nor yourself, then you will lose the battle. Thank you very much for your attention.
Dr. Tarek. Now, Dr. Tarek, if ever you decide that you want to change your profession, I would strongly recommend that you become a professor.
Oh.
Because you made an excellent presentation. You presented a complex subject in such a simple manner. I am absolutely taken aback with some of your slides. You know, the AA plan, that circle that you did, where you so simply explained diet, exercise, control sugar, weight, lipids, blood pressure, smoking, and sleep. That was good. But I think your winner was certainly the A, B, C, D, E, F, S. That was a winner. It's so simple, Dr. Tarek. I mean, AIC, A1C, blood pressure, cholesterol, diabetic drugs, exercise, food and diet, and smoking. Now, you know, it is an art to be able to present a complex subject in an understandable way. It is a gift, and you have that gift. So I strongly recommend, sir, that if ever you would like to change your profession, you should look at being a professor. Thank you so much, Dr.
very
Tarek.
much. That's very kind.
Thank you, sir. Thank you. Dr. Wilku, I've noticed that we have many questions. So please go ahead, sir. Dr. Wilku, you are muted.
Yeah, thank you, Professor. First of all, thank you very much for Dr. Tariq. It was really a wonderful presentation, simple, understandable, pinpointed with all the pointers to remember easily. Really, after a long time, I have seen a wonderful presentation. Like Professor said, if you think of changing your profession, you should be a teacher. Teaching, presenting is wonderful. Great. So I'll be taking few questions I have been getting on my chat box. First, Orhan. Doc, you have mentioned many things. See, Orhan is asking, he has a stressful work. Can high stress cause or aggravate heart problems?
Good. Yes, of course. There are many mechanisms in which could the stress work or has a negative effect on our bodies, on all, not only the heart, all the bodies. The cholesterol, when you under stress, you will have a high cortisol level. The cortisol, it's a hormone that help the body to overcome around the stress. On the adrenaline, the stress hormone, the adrenaline or noradrenaline. All of that, it will making the metabolism of the body worse. And of course, the adrenaline make the heart working more. There are, yes, there are, could be a negative effect. But most important of that about stress, to speak about stress, I think every one of us has a stressful job. I think it's important to learn how to deal with stress. For example, the yoga, it's helped me in meditation, helped me to reduce my stress. The sport to help in recent life. Some job without stress. I don't think there are a job without stress. I don't know if there are a job. I want to change my my job, but it's we should deal with the stress. The stress. Every one of us has his stress, and of course, some people have a lot of stress, but it's the most important to try to deal with the stress. Not always possible to change your job or what you learned, but very important to have the time and give time to your body to regenerate and could making something better.
Yeah, true. Really, there is no work without the stress. Life is also always a stressful thing. Yeah, great. Jinsi has asked this question. Generally, it pops up in the any news channels or social media, internet. There are a lot of articles on this, and people are giving here and way reasons for whatever you can say. She has read an article, chronic blood pressure medication makes you diabetic. Is it true?
No, blood. That's of course it's not true. It's always difficult to say something cause something. Like I try to show, it's not one problem, one reason, or the one reason, one think would cause the disease. It's a multifactorial disease, and always we should not forget. We have a lot of patients. They are pre-diabetes. They have the hemoglobin 1c. It's in the gray zone. It means they have disposed to diabetes genetically. I don't know blood pressure medication which making the sugar. Some statins, there are a connection, but without a strong data. Some statins will making the blood sugar be manifesting, as that I say that, but we see a lot of people, they have the genetically disposition, and that's mean every medication has a side effect. And when you take the medication with knowing, like I will see my last slide, if you know your enemy, your disease, and you know what you will win from the medication, and then the side effect, you should take the side effect at risk to happen. But for the answer, no, I don't know. Some statins could make the sugar manifesting, but not causing sugar. To say something causing such chronic disease, it's a very difficult thing. Scientifically, we don't have such data.
Yeah, true. There are a
The
lot
answer,
of
no.
studies and yeah, true. There is another interesting question. Arav has asked, can diabetes trigger heart attacks and stroke? You have shown in the presentation also. So he is asking again, can diabetes trigger heart attacks or stroke?
Yes. Yes, of course. In many mechanisms in diabetes, it's like I try to present that all the body are involved on the inflammation rate. Inflammation in all the body, it will be more. The inflammation is very important factors now that cause the atherosclerosis and cause a lot of other disease. Of course, that's very important risk factors.
Yeah, true. So I don't think so because I am receiving a few other questions in my WhatsApp. It's a similar questions what you answered just now. Okay, from my side, I'll be saying the last slide you have mentioned about ABCDs. So that was wonderful to understand and to remember. And my point out of this A to F, A, B, C, D, E, F, and S, what are the three important factors the person should be caring about? Out of these A to F, S, what are the three important factors you will be saying to consider at the most?
It's a very good question. Very good and difficult question. That's yes. If you ask me, I would say try to making it from importance to less importance. Of course, the diabetes, it should be the hemoglobin 1c. And the first, the second is the cholesterol. The third, I would say the blood pressure. Of course, smoking, it should stop. It's easily to stop, easy to speak about it. But if you smoker, you know that's very difficult to stop it. Good, but all of them, I will say the cholesterol, it's kind of circle. You should try to work on all of them, then you will have the best outcome. If you try to work on some of them and let the other, it could be changed and the balance will change if that will be protective factor or effect. I don't know, to be honest. If that possible, try to work on them. Very important to get all of them. Sport is very important too. That we see that some people have yesterday. I came the night I'm on call. Have patient. He told me he makes sport. He could reduce 20 kilogram from his body weight, and he could stop then his diabetes medication, his blood pressure medication. It's very important to try to understand the problem. It's metabolic problem that involves all the body, and the weight loss, it's not only the weight loss, it's more health. You will get more health if you could get your body weight a couple of kilo less. It's very important. Difficult, as you asked me very difficult question. Like I see, I try to make that is very good question. I don't know, to be honest, which of them. Then everyone have his personal preference. The optimal to work on all of them in balanced way, that will be the best option, I think.
Yeah, true. My opinion from that slide, when you were talking about, so my understanding was that first three, like HbA1c, blood pressure, and cholesterol, these three should be for monitoring your health, and the other three, diet, exercise, and smoking, should be proactive activity you should be doing to manage the first part of three. So that is my understanding, and whenever
Yes, I
I'll
think
be
it's
talking to anyone, I'll be explaining like that.
very good.
So thank you
Very
very
good.
much.
Very good
Thank you very
explanation.
much, Dr. Tariq. I don't think so because now there are few questions on the WhatsApp, but still it's already covered with your answers. Professor, over to you.
Dr. Wilku, I think that was probably the most unfair question you could ask any speaker. You know, it was almost like asking a father, which of your children do you like or prefer? But I must tell you, I am delighted. Right at the beginning, I said that Dr. Tariq should be a professor. And I am delighted with Dr. Tariq's answer because he actually said, of course. And he went on to answer that all of them were important in different ways. So he was able to very conclusively, without selecting a child more than the other child, He completely and comprehensively brought all the A, B, C, D, E, and F and G children on the same plate and brought them out with equal importance. I think he will also make a great father, Dr. Tarek. Well done.
Thank you, Professor. Thank you, Dr. Wilco.
Well done. That was good. Okay, friends. My absolute pleasure to give the vote of thanks for this session, and I would like to, from the bottom of my heart. Now that is a great way to present it. From the bottom of my heart to a cardiologist. There's no better way to present it. Thank you very much, Dr. Tarek. Thank you very much. Thank you very much. Dr. Wilco, you could not have asked a better question, sir. It was very kind and very straightforward, but certainly a very, very good question. Thank you so much. My dear friends at the back out there, our computer specialists and the AWLM team and the RAK Hospital team that help us to put this together every week. Thank you very much. And my dear audience, those of you who listened into today's program, you were privileged to listen into today's program. I will thank you for your presence, but I must also say that you should thank our speaker also for his presentation. And now, finally, I don't quite know what Dr. Wilco has for us next week. Do we have a webinar next week? Of course, you can't get Dr. Wilco to fail. So we have a webinar next week. Ladies and gentlemen, a webinar next week on the next Friday, that would be Friday, the 1st of November, we will talk about diabetes and renal disease. Until then, good day and thank you very much.